And welcome to the COVID-19 briefing. Director of Health, Dr. Ronald Lam, Dr. Chang Chuk Kwan, Head of Communicable Disease Branch of Center for Health Protection, and Dr. Lau Ka-hin from Chief Manager of Hospital Authority. Dr. Lam, please. Good afternoon, friends of the media and Hong Kong people. Today is the 6th day of the Chinese New Year, and I wish everyone good health. And I would like to give an update on the COVID-19 situation. We are now in a critical phase. We have over 300 confirmed cases, and later Dr. Chuang will go into the details. Of these 300 plus cases, and also from the past 2 weeks, altogether the total number of confirmed cases reached 1,921 cases, and the unlinked cases are at least 320. Of these currently unlinked cases, over 80% of them are related to the Omicron variant. And during this fifth wave, so far, it originated from two clusters. First, the Silka Hotel cluster, and the second, the Hamster cluster. And cases confirmed to be linked to Silka currently stands at 768 and still rising. And for the Hamster cluster, the number of confirmed cases at 854, and there's still some 54, and still some cases to come. We can see multiple transmission chain in the community at triple digits. And especially for the past few days, most of the cases, quite a number of them originate from cross-families gatherings. For residential buildings, since the beginning of this break, over 24 residential buildings reported vertical or lateral transmission. For these buildings, we immediately executed evacuation action even during Chinese New Year on a daily basis. For the residential elderly homes and the care intention homes, and due to the COVID-19, we have 10 home residents need to be evacuated. So far, we see cases all over Hong Kong involving all walks of life and sectors. In terms of geographical breakdown, as of yesterday, the district of the most cases, the most unlinked cases, and the top 5 are Sam Shui Po, Sha Tin, Kowloon City, Kwai Ching, and Wong Tai Sin. As I said, most of the Hong Kong district have reported cases. In terms of our contingency planning, we must stress that we must utilize a precision approach to cope with this wave, which includes targeting high-risk areas, and with the number of measures in place, for example, restricted testing declaration, compulsory testing, voluntary testing, and handing out rapid testing kits for individuals in risky locations. Due to the surge in caseloads, and in the past few days, we have announced that when these cases may overwhelm the public hospital, we might activate the contingency plan. That the phase 1 and phase 2 of the Penny Quarantine Center will be vacated to admit residents and patients from HA where suitable to, and we are now preparing in earnest. For example, on how do we transfer it currently under quarantine to home quarantine. In terms of the caseload, as we are in a critical phase, we once again appeal to the members of the public to do their part to adopt all safety precautions. As we all know, for the vaccination of age 80 plus, the percentage of having 2+ shots is only at 20%. And for the 70 to 80 years old, the vaccination rate is only about half, which is way below our target. Once again, I appeal to the public that I hope that all the elderly, especially their family members, that they should bring them to inoculate against COVID-19. And one of the characteristics of this wave that we noticed, there were a lot of cross-families gatherings, especially during the Chinese New Year. We expect that there will be more cases to come. And acting out of concern to family members, they should reduce such family gatherings. Thirdly, and for social interactions and others so on, it also be minimized, and make sure you stay home. And on personal protection, we must wear a mask properly, wash our hands, and sanitize them frequently. There are quite a number of building clusters. Besides taking all the health precautions, we should also keep our flat clean, and especially ensure that you inject a half a liter of water into the U-traps. And for those who are showing symptoms, even insignificant, if you feel slightly unwell, please go see a doctor so they can get treatment early and get tested as well. And I would like to express my gratitude to the frontline anti-epidemic workers and all healthcare workers for over the past year or so, including our colleagues from the DH, have been working round the clock to set up and implement various anti-epidemic measures. In the process, I would like to thank the different departments for mobilizing their staff to commit themselves fully to fight this pandemic. In this fifth wave, this is something of an unprecedented magnitude, and this will really challenge our healthcare sector, and our healthcare staff and the Department of Health and all the government anti-epidemic personnel will stay with their post. And anyhow, I hope that the public can understand that the pressure and the contribution they made and do their part to protect themselves, reduce social interaction and family gatherings, and keep their own personal hygiene in order to win this battle. And now I hand over to Dr. Zhang to talk about the cases. And last night we confirmed 342 positive cases. Case number 15073 to 15474. Currently we have about 100 cases that are related. The other are pending investigation. Of these 342 cases, so far all of them are local cases, and 20 of those from L4 for the Delta variant. And for the yesterday cases of the 551 cases, 136 of those are untraceable cases.
As Dr. Lam was saying, altogether there are 320 so far which are untraceable. Amongst those untraceable yesterday, most of them happened in Sham Shui Po, Sha Tin, Wong Tai Sin, Yau Chim Wong, Tuen Mun, Kowloon City. Of course, there are some in other districts as well. As for related cases, in Ever Happy Aged Home, there was one inmate who was 93 years old, unvaccinated female. She was confirmed. She lived in the Ever Happy Aged Home in Sham Shui Po, Eun Chau Street. There are 30 aged people who have to be quarantined. There are also 7 staff members who need to be quarantined. As for the Salvation Army Po Lam Aged Home, one health worker was confirmed. 40-odd aged people have to be quarantined as a result. In Homantin, Shangxing Street, at an institution, there were 2 confirmed cases and 2 preliminary positive cases, including someone working in the kitchen, nurses, in other words, the staff there. And we are still counting the numbers. On the ground floor, first floor, and third floor, there are people who have to be quarantined. As for buildings, in Shatin Shek Mun Estate Mei Shek House, there were 2 confirmed cases in unit number 07. We have to see whether the people there have to be quarantined. And then in Heng Tai House, Tai Heng Estate in Tuen Mun, there was restriction testing done yesterday, and some units showed confirmed cases. 2 are unit 06, 2 are on the 10th floor. We will have to investigate the situation to see if there is vertical or lateral transmission. In Shemshui-Po, in the Akbar Society, 11 people have been confirmed, and those people have been there, and 1 is preliminary positive. And then in Yuen Long Plaza, there are now 13 people who work there are confirmed, including security guards, cleaners, sales staff, and people who worked in cafeterias. I can see that these cases would include people who have been eating out since the 30th, 31st of January, and then into the first week of February. Maybe this is the Chinese tradition that we go out and eat and see family members during the Chinese New Year. And some people have been to Polin Monastery and Che Kung Temple, and we are afraid that there would be more transmission amongst these places. That's all. And then Dr. Lau, please, the HA situation. Up till now, AM, this morning, in the 24 hours, we recorded 356 reported cases. In the last 24 hours, 138 people were discharged. Altogether, 13,125 people have been discharged so far. Now, 1,495 patients are in the North Lantau Hospital, Hong Kong Infection Control Center, the HA Infectious Disease Center, the AWE Community Treatment Facility, and 15 public hospitals. They are being treated there. And there is 1 patient who is 13400 who is still critical. And then there 14814 who is in a serious situation. This patient has chronic diseases. I would appeal again to people who have chronic diseases and elderly people, especially those who are in elderly home. Please receive vaccination as soon as possible. And then I would like to make an appeal about the accident and emergency departments. Recently, because a lot of testing has been done in the community, a lot of rapid antigen test kits have been distributed to the community. Many people can see preliminary positive results, and they go to the A&E departments, and therefore the A&E departments are flooded with people. These people have to wait for long at the triage centers at the A&E departments before they can be hospitalized. I'd like to make an appeal to the public. If you have done a community testing, and if you receive an SMS telling you that you are positive, please remain at home for further instructions from the Department of Health. Even if you go to the A&E department, it will not quicken the process for you to be hospitalized. And if you have taken the rapid antigen test and you see a positive result, if you do not show any symptoms, please keep calm. And when you go to the A&E department, please be patient for the staff to arrange for another tests in order to confirm the testing result. Since we are still having a serious situation, and tomorrow will be the first working day after the weekend, and the HA expects a surge in the number of people at A&E, which can become saturated in capacity. Therefore, we appeal to the public, if you have light symptoms, please consider visiting the outpatient clinics or private doctors. And then I'd like to talk about 3 cases. One in Kwok Wang Hospital orthopedic ward, an 89 years old female patient was screened, and she is showing preliminary positive result. This patient has been isolated and is in stable condition. According to tracking of contacts, 1 staff member and 4 patients in the same ward have been listed as close contacts. And then there is another one, 62-year-old female patient at Queen Elizabeth Hospital. At noon yesterday, she was undergoing a dialysis in the outpatient clinic, and she showed a negative result in the regular testing process. And then she went through another regular test, and she showed preliminary positive result, and she showed no symptoms. She is now hospitalized and also in the isolation ward. She is in a stable condition. And we have done the tracing of contacts, and we found that this patient, when she underwent dialysis, she took medicine, so she took off her mask for a short while. Therefore, the 4 patients in the same ward were listed as close contacts. These 4 have been moved to isolation ward for quarantine surveillance. They have shown no symptoms. Right now, no staff members have been listed as close contacts. The last one in Pok Oi Hospital, in the integrated specialty ward, a 43 male went through screening upon hospitalization, and he showed a preliminary positive result. This patient has been isolated and is in stable condition. Tracing of contacts has found that the patient did not wear a mask properly when he waited in the ward, and he also vomited. A staff member who took blood from the patient, and also a ward assistant who treated the patient after the patient vomited. These 2 have been listed as close contacts. And 6 other patients who were in the vicinity of this patient had been moved to the surveillance ward. And other staff members who were there would undergo 14-day medical surveillance. All these 3 wards in those hospitals have been arranged for disinfection, and the CHP will follow up. Now it is time for question and answer. Please raise your hand and use the microphone, and also let us know your organization before asking your question. I'm from Oriental Daily. I'd like to ask about Tai Hing Estate. When will the restriction testing be lifted? And also, you mentioned some serious cases. I'd like to know whether those people have been vaccinated, whether they have chronic diseases, and what kind of variant do they show, and also how many preliminary positive cases are there today. And also, as you know, people are lining up for testing in many districts in Hong Kong. And you said that only high-risk areas should be subject to compulsory testing. What do you mean by high-risk areas? Because there are outbreaks in many districts in Hong Kong. Will you make arrangement for a more orderly situation? Because people have been lining up for 6 hours, and people are exposed to transmission risk while they line up.
And thank you for your question. I will talk about the epidemiological categories and our testing arrangements. As for the details, I'll hand over to Dr. Chang for supplement. Overall speaking, we need to combat the COVID-19 in a precision way. And from the risk assessment, we need to determine which the group of people need to put in more resources. For example, let's say a residential block report a cluster of cases, and we notice either vertical or lateral transmission, then let's say we see the circumstances, or let's say the drainage issues that we must evacuate the residents, as we need to remove the source of transmission. And the other cases are more diffusive. Let's say for a super spreader event which led to widespread environmental contamination, or a short distance air transmission which led to cross infection. As long as we identify a cluster pattern, then we will try to aim for early identification and early isolation. Let's say you've been tested, and how the quarantine and the isolation be conducted. We need to look at the causes. Let's say extensive environmental contamination. As long as you remove the source of contamination, and we not need to consider the isolation capacity and caseload, that we need to conduct a lockdown for longer periods. Therefore, we need to conduct an epidemiological assessment to determine the high risk, and also look at the way of transmission and to resolve them quickly. Well, there are three categories. A lockdown testing, well, it could last for a day, or in Quaiqing, it could last more than a day. Compulsory testing, sometimes there may not be a lot of cases, or not quite a cluster. Then we would take a more macro approach. Let's say at the location and the surrounding likely exposure sites, then we will ask them to go test it. Let's say if for even bigger area, then we'll adopt voluntary testing. Let me cite an example. Take Samshepo, for example, as we have more cases in the area in more diffusive manner. For the locations which reported cases, we target them. However, in a wider area, then we'll take a voluntary approach so that the residents in the area can get tested early. For this wave, we have introduced a voluntary testing. When the transmission is going so swift and extensive in terms of contact tracing and isolation, well, we need to racing against the clock. And nothing is quicker than the members of the public get quickly tested themselves, then report to assistance. For example, we'll put the person into quarantine or isolation. So this is a multi-pronged measure based on the risk level. In terms of our testing capability, well, it is indeed unsatisfactory. We notice the long queues outside the testing centers. The secretary mentioned that we must boost our testing capacity. For the daily capacity of 100,000, we'll step it up to 200,000 or 300,000. As we reactivate the air-inflated laboratory in Mount Anshan, by then the testing capacity can reach as high as 300,000. Therefore, we will be monitoring the testing situation, and for the vaccination or any chronic illnesses and so on, especially on inoculations. Well, the source of the super spreader event, for example, the air crew cluster, the air hostess and the family members were not vaccinated, and the Silka cluster, then spreading to the Quaiqing district, the husband was also unvaccinated. If you are unvaccinated, in these cases you mentioned, you will notice that the viral load was high, which led to a super spreader event. The vaccine is effective in helping to reducing the risk of severe symptoms or even death. We especially hope that the boost the vaccination rate of the elderly, as they are the most vulnerable and also a group of very high mortality rate. I now hand over to Dr. Chen to talk about the preliminary positive cases. There are over 300 preliminary positive cases. For the high-risk locations, like Dr. Lam said, a lot of the unlinked cases are in some Shoupo and some in Shatin and Yaoqing Wang and Kowloon City and Tuen. And the residents in those districts need to pay extra attention. And let me talk about the case number 814814. That patient is an 84-year-old male. He has a chronic condition. From what I know, is high blood pressure. The virus strain was Delta, and he was unvaccinated as well. When he was admitted to hospital, he was admitted on the 3rd of February. The symptoms were quite mild, like coughing and fatigue. And from today, he deteriorated sharply, and he is now in ICU. He has all the risk factors, for example, being old, 84 years old, chronic condition, and so on. Like Dr. Lam said, if we can get vaccinated, it will reduce the complication and the mortality risk, even though he is not a resident of the elderly home. And we know that these residential homes have a lot of elderly and frail residents, and their vaccination rate is very low. If you have any relatives living in these residential homes, please give your consent, arrange to get them vaccinated. And the gentleman in the last row. TVB. So, Dr. Lam, you mentioned that for some of the patients will be sent for home isolation. What type of patients can be sent for home isolation, and can you give us more details? And just now, Dr. Lau said he noticed that people who tested positive should wait for the Department of Health instruction instead of rushing to the any department. For the preliminary positive cases, what are risks of them staying at home? For Department of Health, and how many patients can you take in terms of preliminary positive cases to isolation center or North Lantau treatment facility? For the Port Oi Hospital case, for the 39-year-old male patient, you claim he did not wear a mask properly and vomited. Does he have an underlying condition that why he didn't wear a mask while receiving treatment? And finally, that for the large area you hope to adopt a voluntary nature in testing, would you consider a universal community testing to screen out asymptomatic cases?
Okay, I will talk about home isolation or home quarantine, and also our assessment of voluntary testing, and then Dr. Lau can talk about hospital cases. Right now, our contingency plan is like this. Why are we poised to do home quarantine? Home quarantine is for close contacts or sub-close contacts. Sub-close contacts are chiefly family members of close contacts. Home quarantine has this purpose, and that is to ensure that when we have a shortage of beds in hospitals, people can make use of the Penny Bay quarantine facility. With that arrangement, we won't put undue pressure on the medical system, and then we will have more time to do prevention and control. And we will be able to take the opportunity to enhance the vaccination rate of the entire population, especially the elderly. The arrangement will be like this. When isolation beds at public hospitals are nearly saturated, then we will kickstart the arrangement. Phase 1 and Phase 2 of Penny's Bay treatment facility would be made available for patients from hospitals. In other words, people who are being quarantined there will be sent for home quarantine when it is appropriate. This will be how it is done. People who are sent for home quarantine will be subject to a series of assessments, whether they live in a suitable condition for home quarantine, and also what kind of risks he will be exposed to. Say, for example, the close contact and the sub-close contact will probably not stay in the same home. The close contact may stay in a quarantine facility, and the sub-close contact may probably stay at home. If some people are frail, they are elderly, and maybe they have comorbidities, and also they cannot take care of themselves, then perhaps we need to take care of them at quarantine facilities. Therefore, the arrangement will be rolled out step by step. First of all, we will start with home quarantine, and then we will spare beds for the needy. Secondly, when people use the rapid test kit and are tested positive, the purpose is really to have early discovery of these people and for them to be quarantined early. Of course, these people may be falsely positive, but they can also really have been infected. And of course, if it is the latter, we of course would like to send them to hospital as soon as possible. As for voluntary testing and whether we should go for universal testing, there are a few aspects. First, as you all know, the CE has also explained the difficulties about universal testing. Secondly, our purpose is really to contain the epidemic and also to go for early isolation. In 2020, we did undertake a community universal testing, but it was not very effective. Therefore, at the present stage, we will concentrate our resources on containment and also increasing our testing capacity and also our isolation capacity. Dr. Lau, as I said, some people may do testing in the community. Usually, the community center will send an SMS to let them know whether they are positive or negative. And if they should receive a positive result, some people may know that they will receive a call telling them to stay at home, and then the DFH will arrange for them to be admitted to a hospital or the North Lantau Hospital, Hong Kong Infection Control Center, or the AWE treatment facility for treatment. But then some people may not want to wait, and they go to the A&E department. But even if they come to the A&E department, now if they are already positive, then there may be a transmission risk, and the A&E department has to look after other patients. And as I was saying, some people may do the rapid antigen test and they are tested positive. They also go to the A&E department. But even so, it does not mean that they will be admitted early. In fact, it may delay their admission. Therefore, I would like to make this appeal. If you should receive an SMS saying that you have been tested positive, please stay at home. Certainly, you have to do prevention and control as well. You must wear the mask properly, and if you need, you can wear 2 masks or with a cloth mask on top of a surgical mask. And also, please do not be in contact with your family members. And also, after going to the toilet, please do disinfection, and whatever you touch, please clean them and disinfect them in order to minimize the risk of transmission. The HA and the DFH will cooperate to take our patients to different places for treatment or quarantine as soon as possible. And then as for the Port Royal Hospital patient, very often when people are admitted to hospital, they are already unwell. They have a disease. They may have difficulty breathing. This patient wanted to vomit, and quite naturally he would take off the mask. And if indeed he would vomit and cough, then the virus might escape into the air. And if our staff members do not have a whole set of personal protective equipment, then they might be infected, and so they will be listed as close contacts. I would appeal to the public that if they are in our hospitals, please wear the mask properly. But of course, if you have difficulty in breathing or you want to vomit, please let our staff know immediately so we can take you to a suitable place, and so that our staff will put on PPE in order to reduce the risk. Sorry, the reporter is not using a microphone. You mean the reception time? Well, usually, if we should receive notice that there are positive cases, and we will coordinate with the HA and send the patient to a hospital for treatment. Of course, the earlier the better, but we are not seeing any delays. Can we answer an English question?
Hi, a few questions from TMHK. So the first one is for Dr. Lam. When you talk about the transmission chains in the community, you said that the number is in 3 digits. Could you clarify a little bit? Do you mean it's over 100 or hundreds? Does it still matter at the stage? And when there are so many transmission chains in the community, do you think we can still conduct contact tracing in a practical way? And to which point will contact tracing become meaningless? My second question is about the sewage testing in the central area. So the samples in the central area, including the US and UK consulates and the CE's residents, tested positive. So why is the area not included in the mandatory testing order? Thank you.
Okay. So I will leave the question on the testing coverage to Dr. John. May I address your question on the transmission? Currently, in GIST, we have over 320 cases cumulative that are of unknown origin. So if one case represents one transmission chain, there obviously will be over 320 transmission chains in the community, bearing in mind that one case can spread to more than one person, representing more than one transmission chain. So the minimum, at least, is over 320. So it is a very widespread and severe situation in terms of the spread in the community. And it is essential and critically important that we continue to maintain the containment policy, especially using the most effective tools of contact tracing, quarantine, and also sending those detected cases for treatment in the hospital. This is the most effective tool to prevent or delay the further transmission ongoing in the community. So, but of course, we have to combine this with other measures, including enhancing the testing capacities, implementing restriction of movement and compulsory testing for affected buildings, and also voluntary testing for widespread areas where the residents reside. So with such combination of measures, coupled with the compulsory testing or voluntary testing where necessary for those areas which are detected positive from the sewage surveillance system, we hope that we could at least delay the transmission chains. In this connection, we can buy more time for the community to boost up the vaccination coverage and also to protect our public health system from collapse in terms of the isolation bed provisions. Right. So for the coverage of testing area, I see Dr. Zhang have any supplement?
I understand the government will provide subsequent follow-up action for the sewage signals into various levels, depends on the coverage of the population in that sewage area. So for certain area, maybe a small coverage population, they would issue a compulsory testing notice, and for certain areas, they will distribute a rapid testing kit, and for other areas, they will give advise those residents for voluntary testing.
下一位，呢邊最後嗰行中間。
AM 730. From the preliminary positive cases discovered by lab and confirmation by Department of Health, how many days does it take? For some cases that are not confirmed, that you can't issue a quarantine order, and that will lead to a time lag which go against the policy of early isolation. And for the yesterday case table, you stop showing the vaccination record. Is it because you feel it no longer necessary to disclose the status or any other reason? Just now, Dr. Chung mentioned some locations. For Poli Monastery and Chegong Temple, cases do you have the time and date, and what are the risks of those who already wear masks? And for the Yulong Plaza, any staff being infected? For the Ever Happy Elderly Home, and did that confirmed case go out, and how do you assess the situation there? And for the cases, I'll let Dr. Chung to explain. First, I hope the press be aware that when we see a case or showing symptoms and tested preliminary positive, that it could be picked up at their private laboratories or through compulsory testing or restricted testing. When the case is preliminary positive, in order to achieve early identification and isolation, we coordinated with the HA by sending them to hospitals first. At the same time, if the sample is in a private lab, it will be sent to the public health laboratory for confirmation. This system has been working well. Therefore, we will not wait for the case to be confirmed before taking the next step. We will start dealing with the case as soon as it's reported preliminary positive. Like the reporter said, well, Dr. Chung mentioned about Poli Monastery and Chegong Temple and Yunlong Plaza. There are lots of cases in these locations. It's illustrated the importance of keeping social distancing and reducing social gatherings. Therefore, we encourage all the organizations to organize virtual events without face-to-face interactions. And for the Yunlong Plaza, that in the shopping centers, that we should visit shopping center less frequently. For Yunlong Plaza, these staff are related. Well, a lot of cases have visited Yunlong Plaza. However, it's hard to blame the Yulong Plaza for these cases. If you live in the area, then you will visit there, or even if you pass by or visit the restaurant, you can't attribute all these cases as to the Yulong Plaza, as there are a lot of them. If the staff member is confirmed, it's no worry, as we have a dozen of them, which I suspect there is widespread contamination there. For the Ever Happy Elderly Home case, he mainly stayed at home. There probably a staff may be positive. For the Chek Hong Temple and Polin Monastery, a lot of them visited on the first and second day on February. That doesn't mean that there is transmission there. As we all know that for Omicron, even if we're wearing masks, if we're in close distance, you could also be infected. Well, not just because there's a case with there might be some other kind of transmission taking place. Now, news. First, you mentioned about the A&E department situation. Well, let's say a lot of people may choose to wait after checking the RAT. It led to a outbreak in hospitals. Maybe at the final phase, then you may decide to introduce home isolation. Based on your current assessment, we consider advancing the timetable that they should stop going to hospitals. Would that be an option? Well, for the preliminary positive cases, a lot of them are showing pending with scant details. Is that you are lagging behind in contact tracing. For the compulsory testing, a lot of people complained of waiting too long for the results, so they can't go to work. Some of the residents, that since they need to get tested repeatedly, well, can you adjust the compulsory testing arrangement if there are positive sewage samples everywhere? Would you consider adopting RAT test to replace testing at testing centers? Well, do you have any contingency plans on this? Well, for the proposed home quarantine or compulsory testing, and whether there be any time lag, I'll let Dr. Lau to talk about the HA. Well, let's say someone is tested through RAT or community testing and found to be preliminary positive, and currently we need to take a precise approach based on the risk level that we would try to isolate him or her at a facility or in a hospital. From the risk point of view, a patient carrying a virus is more likely to spread the virus than a close contact. If that person is placed in a confined environment, and well, his or her health may change anytime, the best way was, so long that we still have capacity, we'll try to arrange the patient in an isolation facility.
But as I said, we'll have to do assessment. If the capacity is near saturation, and even if there are positive cases, they are in different categories. Some may have different symptoms, and we'll have to see what the capacity is like at a certain stage. And secondly, you can see a surge in cases, but in order to protect the integrity of the medical system, in that we need to take care of those who have to be taken care of, we would like to put an end to the epidemic so that elderly people will not be affected with a serious condition or even death. And to do that, we'll have to do our level best and take all measures in order to do containment and take targeted action. In this way, we can show responsibility for the health of the people. The challenge now is to race against the epidemic. The spread of the epidemic may be faster than our efforts used on early detection. Why do we start to distribute voluntary testing kits? It is because this is the quickest way for the public to discover whether they have been infected. This is the fastest way of screening. And secondly, in order to delay the pace of spread, we must have the cooperation of the public, and we thank the public for doing so. We must do good personal hygiene and keep social distances and not take part in gatherings. So on the one hand, we take preventive measures, and on the other hand, the people can also do their part in prevention. In this way, I believe we can still achieve our purpose of containment, and that is to prevent a collapse of the medical system and also to secure more time for boosting the vaccination rate. With regard to compulsory testing, and what should we go for? Should it be compulsory testing? Well, we have to assess the risk. If there is a big gathering, then perhaps we should go for restriction testing and also put in the restriction for a longer time. That would be more effective than voluntary testing, and that is for sure. Therefore, it really depends on risk assessment. If we only have one measure, then we may not be able to take the most decisive measure for high-risk cases. Dr. Lau, over to you. The situation now is that after people have done the rapid antigen test and are tested positive, then according to the Department of Health's suggestion, they may go to the A&E department. Upon arrival, and if the patient tells us that he has been tested positive, we will isolate him immediately. We have a triage station to treat these cases, and then they will be sent to negative pressure wards in order to do a swab test, which is a nucleic test. Because as far as antigen test is concerned, it is only a preliminary test result. We need to confirm whether this person is a COVID-19 patient, and we'll do a swab and do the nucleic test before we can confirm the case. Now we see more people taking these tests, and therefore there are more positive patients discovered, and they go to the A&E department. And we'll follow the procedure I detailed just now. And of course, if more people go to the A&E department, they will have to wait longer. They may have to wait at the triage station for the nucleic test result. If it is positive, then he will be sent to our isolation facility for treatment. Because after all, the rapid antigen test is only preliminary, and we must go for a nucleic test before the case can be confirmed. This is what we are still doing. Of course, if there are more people going to the A&E department, and if the triage station is flooded with people, then we'll talk to the government and the DFH to see if there are other ways to process such patients with a preliminary positive result. The gentleman in the second row. I'm from Phoenix TV. We can see that there are more than 300 confirmed cases in the last 2 days. Did you expect this? I'd like to know whether this is reflecting that Hong Kong has certain difficulties in asking people to go for voluntary testing. And also, what is your assessment of the peak of this fifth wave? And do you think such spread of the Omicron variant is related in any way to the vaccination rate. And also at the Penny's Bay Quarantine Center, how many isolation beds do you think can be made available? Those questions, please. Thank you for your questions. Can you understand Cantonese? Okay, I will answer in Cantonese so that other media friends can understand me. First, right now, we still see an increase in the number of cases. As I was saying, over 320 cases are still untraceable. That means we do not know how many generations of transmission have taken place, and there are invisible transmission chains in the community. And therefore, we cannot make any projection of the peak of this wave. But given the present trend and also so many invisible transmission chains, we certainly know that we are not at the peak yet. Our assessment is that it is still rising. At what stage will there be geometric increases? Well, according to our experience, when suddenly there is a trigger point and suddenly there is a surge, then very often it would mean a super spread case, like the Soka Seaview Hotel cluster. There are over 760 people in this cluster, and there is a super spread situation. If this happens, well, it will mean that there is a geometric increase in cases. But we don't know when there will be such super spread situations, and we can only be prepared in two ways. One, we need to rely on the public. They should protect themselves. They should reduce social contact and do what they should. Then there would be a reduction in the chance of super spreading. And two, we have to be really accurate and targeted in our work, including testing, early isolation, etc. But what is most important is that before the peak arrives, we have to protect the medical system. Therefore, we are already making preparations for a situation where there will be a huge increase in cases. Then we will use our quarantine facility to do isolation treatment. And then the close contacts and sub-close contacts will be kept at home for home quarantine. But there are different principles to adhere to. First, whether the home environment is suitable, and the risk this person would be exposed to if he stays at home vis-a-vis he will be put in a treatment facility, and also his own health condition, whether he has chronic diseases and whether he has been vaccinated and whether he has other comorbidities, and whether he is an elderly person not being able to take care of himself. Well, these people perhaps should not be sent for home quarantine.
Well, for the vaccination percentage, we have not kept such statistics for the Omicron wave. Whether you're vaccinated or not, that you can be infected. One thing for sure, if you are vaccinated or even receive a booster shot, according to the data, it can prevent severe symptoms. This is a very important part in protecting our public healthcare system. When your symptoms are mild, then there will be less demand on care and attention and treatment, and you can also discharge earlier to vacate the beds to more needier patients. Well, now over to Dr. Lau. Well, for now, the phase 1 of the Penny Bay facility will be used as an isolation facility if we need to, let's say, and if the current 300 plus beds are exhausted, then we will tap into 10 Penny Bay. Then altogether, there are over 3,500 units. We shall start with phase 1. What's the difference between Penny Bay and the current isolation facility? For Penny Bay, we cannot provide X-ray, and we may not draw blood. However, it will be attended by the healthcare staff. We are now working on the arrangements. While there will be, then we will dispatch doctors and nurses. For those cases that will be sent to Penny Bay, there are likely asymptomatic or very mild symptoms. We make sure we'll choose the right patients. For example, the younger patients, no chronic conditions, vaccinated. Well, compared to the fifth wave home and abroad, they are usually in more stable condition and less chance of deterioration. While the healthcare staff are just here for standby and able to provide simple medication treatment, for example, painkillers and cough syrup, etc. If there are any changes after doctor's assessment, we will arrange them to be sent back to the HA hospitals or the infection control center. Well, this is a multi-tier approach. For the severe cases, we'll keep them in hospitals. Then the less severe cases in the infection control center, then or to Asia World Expo for the asymptomatic or the mild cases, then they will put them into the Penny Bay facility. Last two reporters in the second last row.
EMP. I have a few English questions. With more districts seeing more COVID-19 cases, there's also a lot of people queuing up for the test, some even for hours. So what is the risk levels of these people waiting to queue like in these extended hours? And also, earlier on, it was mentioned that 10 elderly homes were affected and people there were sent to quarantine. May I ask which districts are these elderly homes all from, and how many elderly and staff in total are also involved in these evacuation measures? And also, in terms of the risk assessments in temples, can we have an estimate on how many confirmed cases have been to all these temples mentioned earlier? And my last question is, with more people getting hospitalized for COVID, what is the tipping point to allow COVID-19 patients to stay at the quarantine center instead of the hospital? Thank you.
Okay, right. Okay, I will take the question on the testing queuing up problems as well as the tipping point for the COVID to start leading to the start of the home quarantine. Okay, and I would invite Dr. Zhang to address the statistics or any information on the elderly home cases or the those other confirmed cases, right? Okay, so in gist, we are seeing some queuing up phenomenon in different testing centers, right? Obviously, this is not desirable, but given that the community transmission is now quite widespread, and our targeted approach to stop the outbreak via extended testing have to be implemented in order to delay or stop the transmission. So this may be inevitable for the time being. But as reported previously, we are planning to ramp up the testing capacity rapidly. Right now, our testing capacity is about 100,000 per day, whereas we aim at to ramp up it to 200,000 per day. So, and also we are planning to set up another testing facility in the Ma On Shan gymnasium. So with this combination of measures, we expect the testing capacity can be increased up to 300,000 per day. We hope in this connection can help to ease the queuing phenomenon. Right. As for the tipping point, first of all, it really depends on how rapid the cases are accumulating. What the purpose of the home quarantine is to release or free up the capacity of the quarantine facilities so that the hospital authority can use these facilities to care for those less severe cases, right? So when the isolation beds in the public hospital in the public hospitals reach a sort of a threshold that is almost overwhelmed, then we would start implementing the home quarantine procedures, right? So it all depends on when the hospital isolation bed capacity are near to the point of being overwhelmed. So I would see if Dr. Lau have any supplement on this.
Currently, we have around 3,000 beds prepared for the COVID patient. And now we have 1,500 patients in all these facilities, including the Infection Control Center, AWE, as well as in the other hospitals. When you're thinking about, we are now having 300 patients per day. So it will occupy the beds to 3,000 very easily. So but we don't wait for all 3,000 beds are occupied, because we should have some times for the opening of the community isolation facilities. We may be 80%, 70-80% of the 3,000 beds. When they are occupied, we should open the community isolation facilities. So we will discuss with government as well as Department of Health to free up the Penny Bay in order to receive the COVID patient which has very mild or no symptoms. They only need very little medical care. They are very safe in the isolation facilities. Yeah.
So for the residential care home affected, one is in Sam Shui Po with around 30 residents affected and 7 staff. And the other one is in Cheung Guan Ngo, the Salvation Army Bolam residence for senior citizens. And there were around 40 other elderlies who need to be quarantined. And also for the Spastic Association of Hong Kong in the Ho Man Tin is a residential care home for the disabled. We are still counting the figures. We need to evacuate the residents in the ground floor, first floor, and the third floor.
Last question, the second row in the black jacket. HK01. First, Dr. Lau, I would like to ask you about the home quarantine, that you allow the close contacts or the sub-close contacts to undergo home quarantine. We noticed that a lot of the buildings in Hong Kong contain subdivided units or have vertical and lateral transmission, or in multiple cases in one single building. Are these buildings suitable for the close contacts to stay for home quarantine? If they have an onset at home, do you see the residents upstairs nearby be infected?
Then the HA, you say many people are going to the A&E department. Well, earlier on you mentioned that you would roll out voluntary testing by distributing rapid test kits. And if people should discover that they are positive, then at the triage station at A&E departments and hospitals, will you make available certain space for these people who are tested positive and go to hospitals? And number 3, every night you will publicize the places where sewage samples have shown positive results. And yesterday we know that in the Central and Western District we can see a sewage sample having been tested positive, and this area would include the consulates and also the police headquarters. Earlier on, the same situation happened in Ma On Shan, and people were subject to compulsory testing. I'd like to know how you decide where there should be compulsory testing. Well, I will talk about home quarantine and sewage testing. Dr. Lau will take the question on the A&E department. What kind of home environment would be considered suitable for home quarantine? Well, that has to be subject to assessment. But we know what is not suitable, say subdivided units, or the design of the home environment is such that people share a toilet and other facilities. Well, if we are thinking of a place for quarantine, then it should be a place where you have exclusive use. And in recent times, we have seen horizontal or vertical transmission. And of course, if that place is subject to a cluster outbreak, then people should not stay there for quarantine. And if a place is free of cases and if the home environment is suitable, then, as I was saying, you still have to be mindful of hygiene at home and the facilities, because in this outbreak, we could see that the air outlets and also the U-traps have been the problem. Every week, we should pour half a liter of water into U-traps. Whether or not people are being quarantined at home, you should still undertake these hygiene measures, and the risk will always be reduced. So if the home environment is suitable, we would allow for home quarantine, but then that person still has to follow our guidelines. This person has to take his temperature at home. He has to do medical surveillance, and he will have to wear an electronic wristband, and he cannot leave home. We think we have to go down this route, because when the isolation system at public hospitals will be nearing capacity, then we'll have to go for home quarantine. But before that, we will do assessments so that we can reduce risks as much as possible. Secondly, sewage treatment. The purpose of sewage treatment is also for early identification and early isolation. When there is a transmission chain in the community, and if we should see a sewage sample showing positive results, then we will go for immediate testing. We can choose restriction testing, compulsory testing, or voluntary testing. And then we'll have to consider different factors. For example, the sewage network. Does it cover a very big area, or it only is linked to one building? How much is the population? And whether the virus detected is a variant strain, and also the risk of spread. We have to consider all these factors before we go for a certain form of testing. Say if it is restricted to one particular building, if the viral load is high, because we can see the viral load from the sewage and also the variant. And if we know exactly which building it is, then we may go for restriction testing. But if it is a network covering a very big area, say the entire Shamshui-Po district, then it is not possible for you to go for restriction testing of the entire Shamshui-Po district, which includes tens of thousands of people. So we have to consider a basket of factors. Dr. Lau, can you add? Before we distribute a lot of rapid test kits to the public, many people are still doing it. You know, you can purchase a kit from the pharmacies. And whenever they test positive, they usually come to the A&E department. Whenever they do so, we'll isolate them and then we'll get a sample from them to do the nucleic test. We see that this is happening more often, and therefore at different A&E departments we have opened triage testing stations. If you have been to an A&E department, you see tents. Tents would afford better ventilation, so we can do better infection control. Each person is put in one tent, so there won't be cross-infection. And we have set up more triage testing stations at the A&E departments so that when patients come, we will immediately do the nucleic tests for them. And exactly because there are more this type of patients, they are waiting longer at the triage stations. Either they are admitted or they go home. And if the numbers should increase after universal testing, then of course a higher proportion of patients will be tested positive. Then we'll do assessment and internal arrangement to see what better can be done. The important things are, number one, we'll have to do nucleic tests for these patients to confirm whether they do test positive, because the rapid test is only a preliminary tool. And secondly, infection control. These people have had a preliminary positive result, and so we must be cautious because there is a risk of infection. We'll have to do more assessment before deciding on the next step. I'd like to remind the public that if indeed you have a positive result from the rapid test and you go to the A&E department, then you'll have to do very good infection control. That is, you have to wear your mask properly, maybe wear 2 masks or wear a cloth mask upon the surgical mask. And please do not take public transport. You should go directly to the A&E department, and also keep good hand hygiene. It is not that all positive results from a rapid test would mean that the patients are positive. But there is a chance of a positive result. Okay, the press conference ends here. Thank you very much. A reporter is speaking, but he is not using a microphone.